everyone. This is Dr. Diane Hayden, publisher of Natural Nutmeg magazine. Welcome to our weekly podcast where I interview our expert writers and contributors for Natural Nutmeg on topics ranging from natural medicine, green living, spirituality, and basically how to live a healthier, more holistic lifestyle. I have with me today Dr. Yvette Whitton. She is a naturopath of Adonai Optimal Health and Wellness in Madison, Connecticut. Adonai Optimal Health and Wellness is a result-based integrative practice specializing in chronic disease and cancer. So thank you so much for being with us today. How are you?
I am well, Diane. Thank you for the opportunity to be on the podcast today.
Yeah,
I am doing very well. Thank you.
That's great. We're going to talk about a lot of cool cutting edge stuff that you're doing, ranging from IV nutrient therapy to stem cell therapy. But I wanted to just back up a little bit and ask and let readers know, how did you get, involved in naturopathic medicine? How did that become your passion, and where did you go to school, and how did you start your practice?
Well, thank you for that question. I am a graduate of the University of Bridgeport's College of Naturopathic Medicine. I received my doctorate from that fine institution in 2009, actually. And I had two children in the process of my education, so it was quite challenging. But after receiving my degree, because prior to that, I was a teacher in the New York State Board of Education system. And so this afforded me the opportunity to live with both my loves, which was education and medicine. But I think specifically for naturopathic medicine, it chose me. And so my journey to naturopathic medicine began in 2013 when I received news that my mother was diagnosed with metastatic pancreatic cancer. And it was everywhere when it was found. And so, with that information, I began my journey into naturopathic oncology specifically.
Wow. Yeah. I mean, I find that I hear that a lot with a lot of different practitioners, whether they're natural medicine practitioners or, mental health practitioners, holistic psychologists, spiritual practitioners, that their profession found them by way of either they were diagnosed with a disease or some family member, had something like that happen, and they just, became really passionate about finding natural ways to treat that.
Mm-hmm. Yeah. And I find also that the Most High gives us what we want, like what we ask for and what we put out into the universe, we get it. So be careful what you ask for, because I remember as a child, I always said, I really want to do something in the area of oncology, because I always knew intuitively that, there was something here on earth that was natural that we could use to help people to get well. And so that was what I carried in my spirit ever since I was a child. And so here we are.
Yeah. Oh, I totally agree with you. I don't believe that, we would be given some sort of a disease or issue that there's not a natural or earthly remedy that we can use. 100% agree. So awesome. So let's talk about your practice a little bit. So one of the cool things that you do is IV nutrient therapy. That's, something that I think many people are interested and curious about. So let's talk a little bit about that. How do you use it, and what's the process like if someone comes to, see you for that?
Okay. So our IV lounge opened in May of last year. So we're fairly new. We have our medical director, who is also a general surgeon, works out of Stanford. So he heads our IV lounge, and our nurse, our registered nurses, and we have per diem nurses that rotate through the practice, and they have, extensive experience in IV therapy, because most of them have a traditional hospital background. And so they work with us to administer these therapies to our patients. So our protocols range from just people who want to optimize their health, people who have nutrient deficiencies, which we determine through our micronutrient testing. And then we have specific protocols with people with diagnoses of chronic disease, including cancer. And so we don't, I'm gonna make this disclaimer statement that we do not claim to cure cancer, but what we do is support the person, the individual who is housing the cancer.
Right.
So that's what we do with that. So we provide an array of nutritional support, high dose vitamin C. We do poly-MVA or palladium complex. It's often referred to by that name, but it's basically alpha lipoic acid covalently bound to palladium. So those are some of the things that we do. We offer Myers cocktails. We offer hydration therapy, because a lot of people might think that because they're drinking a lot of water, they are hydrated, but not necessarily.
Well,
so those are just, without going into too much detail, that, those are some of the modalities. We also offer NAD, and that's very helpful for people who are attempting to recover from addictions. So yeah, I'm really, really excited about that. And my dream was always to have a holistic or integrative center, because we know, especially with chronic diseases and cancer, that when you integrate your health, when you combine the conventional with the naturopathic modalities, you optimize the outcomes for the patient.
Oh, of course, because when you think of it, basically someone on chemo is essentially putting poison into the body. And so then, and sometimes it knows exactly what cells or what organs to target. And sometimes there's, like other things that get destroyed in the way. So to me, it's a way, it shouldn't even be a question as to whether people should also be doing natural or integrative therapies, because you want to basically build up your body to be able to handle, chemo dosing and that kind of thing, for sure.
Yeah.
One question I think people would have is, why would I do IV nutrient therapy versus just taking supplements?
Okay, so I am really, really glad that you asked that question, because we're not so much what we're eating, but we are what we absorb, right? And so a lot of us, unbeknownst to us at times, we have issues in terms of GI health where there's inflammation. So we're not necessarily assimilating and absorbing what we need to from our nutrients. And so it becomes more effective then to get those nutrients directly into the bloodstream, where they can be uptaken by the cells and used in the cell's activity.
Yeah, absolutely. Because I think, first off, I think that, when I have this discussion with people who don't agree with taking supplements and they say, oh, I get everything I need from food. Well, I'll say, oh, okay. Well, first of all, you need to really do some research on what are we actually eating in 2020, and how much of this food even still really has viable nutrients. I mean, you could be eating something from California that was picked before it was even ripe. You could be eating, things that just because of the soil they're grown in or just not. Our fruits and vegetables, I don't believe, have the amount of vitamins and minerals that they had many years ago. And I think that's a huge issue with people not getting enough of the right nutrients. So there's that factor. And then, like you mentioned, even if you were eating, all different kinds of foods that did have adequate nutrients in it, then it's your body, depending on your age or what other chronic issues that you have, as to what it's actually going to take up and use, because it has to pass through your entire digestive system. So I love this as an option for people that, could either aren't eating great or don't have access to the right kinds of foods, or their body just doesn't metabolize it. Like if you have a B vitamin deficiency, you're not gonna, or there's a gene for that, you have that genetic thing that causes you basically to not be able to metabolize and uptake B vitamins. There's lots of situations like that where you think you're eating right, or you think you're taking supplements, but you're still not getting what you really need.
Yeah, absolutely. I agree, because the reasons why you might not have adequate nutrients through food is, multifactorial. And as you said, it's the soil. Are you eating organic? Are you able to afford and consume on a regular basis organic food? And even if you're eating exclusively organic, are you digesting? And another thing that I tell patients is that most of us, if you're over 40 years old, the input of the enzymes from the pancreas decreases, right? Because those secretions from the pancreas are also necessary for dissolving excessive buildup of proteins within the body that can cause disease, one of them being Alzheimer's disease, right? So the wisdom of the body moves towards what is most important, right? And so the cleanup of the excessive proteins are very necessary. And so the amount of these digestive enzymes that are available for digestion of food is not as adequate as it should be. So, having or taking a digestive enzyme, with meals is also something that I encourage, my patients to do.
Right. Yep. Or commonly referred to as a probiotic.
Yes.
Or more scientific.
Digestive enzymes and probiotics, both.
Yep. So obviously you do all kinds of different therapies for specific health issues and things like that. But you also mentioned, like, let's say I'm just, I'm pretty healthy. I don't have any disease state right now. Mm-hmm. This is something that I can do for preventative measures to boost my immune health or just my energy or anything like that. You would recommend that for people?
Absolutely. Absolutely. Just to support a healthy immune system, I encourage that. To support detoxification in the body, I encourage IV treatments for that. So again, you don't have to have a diagnosis of a chronic disease to benefit from intravenous therapies.
Right. And again, I'm sure all the protocols are all different and individualized, but for someone who's doing it for preventative measures, how often do you recommend someone come and do that?
So that depends. Like if somebody is working out or they're involved in an aggressive workout routine, then I would say once a week for support. But my, my philosophy as a practitioner is that we don't guess, we test. So we use our micronutrient testing to determine where the deficiencies lie.
Okay, yeah, that's great. Is that a blood test that you do? Or?
It is. It's a blood test that I draw in my practice because I'm also a certified phlebotomist. So I draw most of my tests, and we do a lot of functional medical testing, testing from blood, urine, saliva, etc. And so I draw the blood in my office. The turnaround time is usually about 2 weeks. And then we get a profile outlining, whether a patient is completely deficient in micronutrients, vitamins, etc., or if they're borderline. And what I love about the test that we use is that we can also determine the antioxidant capacity of the body, whether that is optimal or not, and also the immune status. So I just love testing, and then I can accurately determine what needs to be repleted or not, right? Because, taking supplements that the body doesn't need, there is such a thing as too much of a good thing, right? So we always want to work to create harmony and a balance within the body. Yeah, and that's when it does its best.
Yeah, and exactly. And also, even from a monetary perspective, why be taking all these supplements that, are just coming out in your urine?
Yeah,
or you're just not
creating
using
very expensive urine.
Yeah, exactly. And how long does the process take? Is it different depending on the individual dosing?
Yeah, it's different from individual to individual, and it depends what's being infused. But I would say generally 45 minutes.
Yeah. Okay.
Yeah. And you're sitting comfortably in, a reclined chair. You have the option of reading. Our nurse is very good at keeping up with current affairs and, being able to meet people where they are in terms of topics that they want to have a conversation about. Our patients love her. And people can bring in iPods and, or iPads. They can watch a movie if they choose. So, yeah, that's awesome. The kind of environment that we have created. So we have, furniture that makes a person feel as though they're at home and not that general, feely kind of clinical environment that you would encounter if you were in a hospital or some such facility. People are really relaxed. We serve tea, and juices and, fresh juices. So yeah, it's a nice environment.
That's awesome. Yeah, that is awesome. So the other topic I want to talk about with you that I think is very fascinating to me that you're doing is stem cell therapy.
Yeah. Yeah.
And obviously, I've heard of it being used for everything from, cosmetic purposes to Alzheimer's and all different kinds of different diseases. So I would say, probably the majority of our readers are more interested in the health benefits from a disease standpoint versus the cosmetic benefits. But tell us about that. Tell us, what, how you got into that and what you've been using it for and what kind of results are you seeing?
Yeah, well, great. So, stem cell therapy is very popular in anti-aging medicine now. It's extremely expensive, and we're talking in the thousands of dollars for one treatment, and it's generally administered via IV. The source of the stem cells can be autologous, which means it can come from the fat or adipose tissue of the patient, which would then go through some further processing to make the stem cells available, and then it would be given back to the patient. Other sources of stem cells, which can be quite controversial to people, is that it comes from cord blood or fetal tissue. And so a lot of people avoid that because of, their beliefs or, that whole thing surrounding harnessing, something that you're going to use in your body from fetal cells or fetal tissue.
Mhm.
So when I discovered the form of transdermal stem therapy, I became extremely excited about that because this is a non-drug option. And so I began to do my research into this when I was introduced to it by a medical doctor from another state. And so I started to look into this transdermal option. And so what I found when I did my research was that in these transdermal patches, and this technology was designed or invented by David Schmidt, a very smart individual. And so in the patches itself, it has what's called GHK copper complex, right? And so that is just a long word for glycine L histidyl L lysine, right? And so this product or this compound is found in really high concentrations when we are young, right, in youth. But as we age, again, the concentration decreases. So some of the uses for GHK, which has an affinity for copper, is that has the ability to regenerate tissue. So blood vessels, nerve cell growth, increased tissue repair, collagen, and elastin. So it's great for, the skin and slowing down the aging, getting wrinkles, etc., because it helps to produce extra collagen. So hair, it's also cellular protective. And that's what I really love about that. It also has great indications in COPD because it's very protective for the lungs. And it's found in human plasma, and it also helps to protect the skin from UV radiation. So these are some of the anti-aging benefits of this particular transdermal therapy. So I mentioned earlier that it is drugless. So there's no drug involved in this. You don't, have to suffer the pain of, or having an IV. Some people don't like having IVs. They don't like the thought of having a needle put in their vein unless it's an urgent situation. But what this patch does, because we're all energetic beings, and so we're radiating energy at specific frequencies. So this copper complex is able to, it's a form of photodynamic therapy because it's able to harness thermal energy, that lightweight portion of thermal energy, and that activates the GHK, that complex. And so that's transmitted through the skin and back into the body where it's able to have its effect by generating new stem cells.
Wow.
Yeah.
That is fascinating. And then basically does your body use it into where it needs it? And so where I'm going with that question is how does it work from the perspective of you want to use it for cosmetic purposes for, you know, skin versus you want to use it for like to decrease inflammation? How does the body know what to do with it?
Well, that's the thing, right? So it has the biological response effect. So wherever it's needed in the body,
It's
that's
where it goes.
where needed the most. That's where it has its most powerful effect,
Yeah.
right? And so what I like about this is that it combines TCM, right? So the patches are applied strategically to actual acupuncture points, right?
Yep.
So we know that in TCM, in order to affect optimal health, there has to be a balance between the meridians, right? And two of the major meridians that run through the body is the Ren, or the conception vessel meridian, which runs through the midline of the body, and then in the back we have the dew. And so when you apply the patches, you apply one patch for a period of 12 hours, and then you remove it, and then you have a 12-hour break, and then you apply a second patch. So that's how it's done, because in between, intermittently, it just gives the body a chance to do what it needs to do. Right. So you alternate the areas where you apply the patches.
Well, wow, that's fascinating. But I mean, I believe that again, like we were talking earlier, the body knows intelligently how it needs to heal.
Yeah.
And how it's going to use, you know, this as a modality to do that. That's really awesome.
Yeah. Yeah.
So what do you see? Like what types of patients do you see that you're using it more often with?
So I like to use the, so there are different patches that Lightwave, which is the company that David Schmidt started making these patches available over a decade ago. So today, as I showed you before, I'm wearing a carnosine patch, which again helps with my energy and mitochondrial support. But this specific GHK complex is called the X39. And so that's the one that I really want to kind of talk about the most. But inflammation is the foundation of almost all diseases, right? And so inflammation increases as we age. We get inflamed when we are nutrient deficient, right? So it's all interconnected. And so, yeah, what I find is that people who have a tendency for inflammatory disease, we see more results or obvious results with these patients. So I know for myself, because I don't recommend anything to patients unless I first try it, right? So I received the X39 patch and I applied it. And the first thing that I noticed, and this was right when we became aware that we had to become quarantined. And so, you know, there was a level of anxiety. I was a little nervous. You know, the office was going to close abruptly. You know, I was not prepared for that. We weren't, right? Who would have known that we would be here at this very moment? So I was not sleeping well at night, right? So every time I would, you know, lay my head down, there was a movie playing, right? Consistently. And so I wasn't getting that restful sleep that is necessary for my body to regenerate and repair. So when I put this patch on, the first thing that I recognized or realized was that I slept soundly throughout the night. And when I woke up, I felt as though I had restful sleep, right? So I woke up feeling energized, invigorated, and that was a new for me.
Wow.
So, yeah.
Yeah, that's amazing. I mean, and as we know, stress causes inflammation. So it's kind of this whole vicious cycle.
Right, but, it is. Another patient of mine, you know, I just recommended that, you know, she tried the patch because she had an injury to her knee. She had had cortisone injections into the knee, but the inflammation remained. And there were times that, you know, her knee was double the size with fluid accumulation in the joint, etc. And it made it very difficult for her to exercise. And her goal was to exercise so that she could manage, you know, her weight. And so, because we know that obesity is linked to people who are at higher risk for, you know, contracting COVID or, you know, being
Sure.
infected by COVID. So yeah, so I said, we'll try the patch. We were doing some other things in terms of supplements, and so forth. And she put the patch on, and she rang me in a week, and she says, you know what? The swelling in my knee is down, and I have increased range of motion in that joint. And I said, great.
Wow. Yeah, I'm sure
Yeah.
you have plenty of other,
Lots of stories. And like I
right.
said, because we're all individuals, what people or patients who try the patch, what they report is going to be different,
Sure.
right, from one individual to another. And like you said, the innate wisdom of the body knows what is the priority, and it will work to address the priority.
Right. So let me just contrast this to IV therapy. Do you do any kind of testing or anything like that with this?
We do, absolutely. So we look at, inflammatory markers. As a naturopathic physician, we look at, C-reactive protein, definitely, but we also look at insulin, because that can be an inflammatory marker. We look at LDH, because that's also linked to inflammation. We look at a substance called galectin-3, which can also be measured in the blood, and that is also an inflammatory marker, right? So we look at these blood products that can give us an indication that there is inflammation in this particular individual. And then after treatment, we can retest these markers and see if they are moving in the right direction.
Right. So let me just reiterate to see if I understand. I want to make sure it's clear to listeners. Basically, what we talked in the beginning, the stem cell therapy that people are probably more traditionally familiar with is where you use your own, stem cells from fat,
Right,
or
autologous.
things. Right,
Yep.
right. This is actually a therapy by which it's sending a message to the body to create more stem cells on its own.
To increase production of stem cells.
Right.
So as I'd mentioned to you before, I'm on day 4 of this fast, right? So fasting, water-only fasts are a really good way to help the body to regenerate new stem cells, right? So when you fast for 3 days or more, what it does is it cleans up the body. So it gets rid of dead, diseased, or sick cells, and it promotes or increases the production of newer, healthy stem cells, right? And these stem cells have the potential to become anything in the body, right? Wherever these cells are needed. And so with this particular type of transdermal therapy, it's actually activating that process in a similar manner as one would do if you are fasting, right? So the thing with fasting, I wouldn't encourage a 3-day prolonged water-only fast for everyone, right? It's not for everyone, and it should be done under practitioner guidance, right, or medical guidance. As a naturopathic physician, and fasting is not new for me. I've fasted for as long as 10 days on water. So my body is accustomed to that. But, I do see the changes, like inflammation is down in my body, right? And I follow that working with my physician assistant who monitors, my inflammatory markers. At one point, my hemoglobin A1C was being elevated, right? And so by doing a prolonged fast, I was able to bring those markers back into normal limits. So this has the same effect on the body in terms of, increasing stem cells, reducing inflammation, helping with the regenerative processes of the body, which as you age, as you know, that doesn't happen as well.
Right. Yeah. And you're actually doing a fast right now. Would you recommend that someone do it in conjunction with fasting, or that you're just choosing to do that?
So what I'm doing is I'm continuing to use the X39 patch with the fasting because I want to see what the combined effects are.
Right.
And I also, today is, like I said, day 4, and usually on day 4, I'm at a lull, right? Where my energy is low, I'm doing very little. So I applied the carnosine patches today. And so that helped because I knew from my experience fasting that day 4 is the time when my energy tends to start dropping off. And so I applied the carnosine patches this morning, and my energy is great.
Yeah, I don't think anybody would say your energy is low today. I think it's fantastic.
Yeah, yeah,
And I've done
definitely.
it.
And I was up early this morning. I
Yep.
had a Zoom consultation with another physician and patient. So yeah,
Yeah, that's awesome. I've done a fast and I don't think I made it past day 3. I was
yeah,
like, oh my God, I'm starving and I'm freezing and whatever. But
yeah,
yeah, so I would absolutely recommend, anyone who's considering doing that to call you because you do need to do it under the supervision of a licensed health professional for sure.
absolutely,
Yep.
absolutely.
Yep. Well, this is awesome. Is there anything else that you wanted to tell us about the stem cell therapy that we didn't cover?
I think that's pretty much it. In terms of the cost, right, which I'd mentioned in the beginning, that if you want to do a traditional stem cell infusion, it's going to cost thousands of dollars. With the X39 patch, they give you over a month's supply of patches, right? Because remember, you're wearing the patch for 12 hours and then you're getting a 12-hour break. And the package of this, and it comes in, I don't know if you can see it, but it comes in like a little box like this. And so that will last you like, over a month. And the cost is $150. So I think it's
Oh,
extremely
wow. That's very reasonable.
cost effective. And
Yep.
that's what I try to promote for patients, especially those who are challenged financially, those who have a cancer diagnosis or an illness of chronic disease, where they're receiving multiple different integrative treatments. And we know that insurance does not cover alternative or integrative treatments. So they're coming, out of pocket to kind of finance their health treatments. And so I'm always looking for something that's cost effective for my patients. And I'm really excited about these patches.
Yeah, well, that's awesome. And I'm sure people appreciate that. So I'm sure that people will be excited about this and want to get more information. How can people connect with you?
Okay, so they can reach me at Adonai Optimal Health and Wellness, as you'd mentioned before. That's my clinical practice in Madison, Connecticut. I'm going to give you our number. Our toll-free number is area code 888-655-8489. Our email address is very lengthy, but simple to remember. It's just Adonai Optimal Health and Wellness at gmail.com. And also they can check us out on my website, which is www.adonai.ohw.com.
Awesome. I just want to clarify the email, Adonai Health and Wellness. Do you spell out and?
It's Adonai Optimal Health and Wellness.com.
Okay.
So you have to spell it all out, and it's lengthy, but it's really easy to remember.
Right. Well, it's the name of the company.
Exactly.
Awesome. Well, this has been so great. Thank you so much for all this information. And obviously this is recorded. It'll be on our website, and we'll also email it out and post it on social media. And hopefully people will learn more about IV nutrient therapy and stem cell therapy. And thank you again, Dr. Whitton. This is great.
Thank you for the opportunity, Diane. Thank you so much. Be well.
Have a great day.
You as well. Thank you.